Today we have Jovanni Tricerri here from the North Valley Community Foundation. And Jovanni, would you just like to introduce yourself and talk a little bit more about your background?
Yeah, thank you, Lisa. It's good to be with you. Again, my name is Jovanni Tricerri. I'm the Vice President for Regional Recovery and Partnerships with the North Valley Community Foundation. In my role in particular, following the 2018 Camp Fire, the North Valley Community Foundation became the philanthropic hub for the recovery. And so I and my team lead those philanthropic efforts.
All right, thank you so much for being here
Yeah.
today for our interview.
Yeah.
All right, so just getting
Thanks
into
for
one of
having
our
me.
first questions, of course. One of our first questions is talking about Butte County. And so in localizing health challenges, what changes do we need to see happen in Butte County?
Yeah, a lot of the changes that we're going to have to see is really access, clarifying the access to care. There are lots of pockets of people who don't know how to access the services that they need. And so one of the things that we're doing with the North Valley Community Foundation is trying to help, for instance, access through the schools and through the education system. That's where a lot of families can access mental health resources. But we need to break down some of those barriers where different agencies are in a way siloed with the approach of who can receive their services or not. So we need to have a really more robust map for providers and for those who need services to be able to access the right type of care.
Okay, yeah, I just having a conversation with Dr. Reed from Rural Health Clinic, and she said one of the challenges is providing those services, and we have all these resources, yet these families can be overwhelmed and not know where to start. So it's great that we should start improving access to care. And it's great that you mentioned that as well, because my next question does touch on that, and it's asking about mental health. And so how can we address mental health on a northern regional level, especially with access to care?
Well, I think the conversation really nationally, internationally really is the first step is obviously addressing the stigma around that and normalizing the conversation around mental health. I think that that is a campaign that not just needs to happen nationally and internationally, but here locally. We need to have leadership that is able to talk about mental health. And to be able to do that, in a lot of the work that we do here at the Community Foundation, we have a lot of focus on youth mental health. And it really is, we're learning from the youth themselves that they do want to talk about it. But a lot of times we as adults don't know how to talk about it. Sometimes we think that by avoiding talking about it, maybe we're not triggering it. And so, for instance, youth suicide rates are going up here in our county. And there's a lot of reasons for that. We've had trauma upon trauma, and particularly coming out of the traumatic experiences with the COVID lockdowns, we do see that there are there are suicide rates that are and ideation that are increasing. So one of the campaigns that we've launched is End the Silence, and that is a youth-led campaign where they're wanting to give us the tools as a community to be able to identify some of the indicators that friends might be dealing with something, and then some of the tools to be able to talk about it and normalize the conversation.
Oh, I think that's great. And I'm pretty sure that it also empowers the youth and gives them a chance to really speak about what's going on with themselves and also helping others as well. So it's more of like a peer mentorship. Is that what I'm kind of hearing what the program is about?
Yeah, there is that component. And so there's a lot of youth-led activities that we're working on, but it really is educating adults as well to be able to address it and talk about it. I think that's the first step that I think we can take. And then being able to know the tools and the resources that are accessible to youth, to adults, to families, so that they can access the type of care they need.
Right, exactly. I think that's great also because really starting with the youth, that's where it really all starts, early life
Mm-hmm.
development, correct?
Mm-hmm.
And so when these youth know all these tools and resources when they're grown and have children of themselves, they can pass on by generations and break that multi-generational conflict in accessing care and also that stigma of mental health. So that's great. That's one of the first steps we need to take in order to improve access to care. Okay, all
Absolutely.
right. Great. Thank you so much for answering that question, Jovanni. My next question in regarding, and you mentioned one of the tragedies right now we're going through is the COVID pandemic, but also given the other tragedies that just Butte County and also all the northern regions of California have experienced. With your role in coordinating emergency response and recovery strategies, especially with campfire relief, do you see changes in how we provide trauma-informed care in the upcoming future?
I do. I think one of the things that we need to address, and something we're addressing as a foundation, is to provide a framework of understanding trauma. So we are putting resources out there, we have a video series that is accessible to anybody to really just begin to understand the science of trauma. One thing, although the campfire was a big piece of our history now and our DNA, we in my role and in disaster philanthropy here in the region, we have the campfire, we have the North Complex fire, we have the COVID pandemic, and we have right now the Dixie fire, and then we have the drought emergency. And all of those have impacts on the daily lives of people. And if it's not if you're not caught in the fire, you have the effects of the fire in Butte County. So there's impact. Every year we are seeing more and more traumatic events. And so we have to build the resilience in our community to meet those challenges. They're not going to go away. We're going to see more traumatic events, unfortunately, but we could be ready for them and be more resilient and have the resources and the support that our community members need in order to access that. So that's, I think the biggest thing is understanding that. So education, we're helping provide that training to understand that trauma it comes in different ways. There's a neurobiology of science, just understanding how that trauma affects the brain. But there's also epigenetics, like how does that transfer from generation to generation? So trauma and the challenges we're facing in mental health could be generational, and generations that they haven't been able to address the effects of trauma. And so we're trying to help communities understand how to identify that, what trauma really is, what mental health really is, and the science behind that.
Right. Thank you so much for answering that question. I think that's also really important, not only for just healthcare providers, but how you mentioned actual people in the community as well who go through trauma and having them identify what they're going through. Because some people may not notice that, they went through a traumatic experience and they're going through trauma. And when they do realize it, they can potentially reach out for help and also get access to care. All right. That brings me into my next question. And I know we discussed some of the health barriers and disparities already with what we've discussed on these certain topics, but what are some of the other health barriers and disparities we are currently facing throughout Northern Region California?
Well, let's just take, for instance, Butte County. Butte County, we don't have a shared identity as a county. When you ask people, as far as their identity here as a region, their community that they belong to, it really doesn't come out that Butte County is our identity. So when you look at Butte County, you have to recognize that there are a lot of different communities in this county, and those communities have its own challenges. If you look at a map of Butte County and Northern California, you'll see a lot of social determinants of health, for instance. You'll see that in different areas of our county or different areas of our region, there are different pockets of poverty, for instance, or even access to care, or the closeness to that, or even things like nutrition. In Butte County alone, the ACEs scores are the highest in this county per capita than any other county in California. And so what that means is in the diverse childhood experiences, generationally, there are children who are growing up with different factors that create, these adverse experiences in childhood. And so we have to address that. So when we look at health, it's looking at some of the social health and creating a safety net that would be stronger in our community for that. I think with rural health challenges is really access. That Sacramento, where a lot of decisions are made, usually puts policy and funding that are tied to issues that are happening more in urban areas. And what we need and what we've been advocating for with our government partners and agencies is to release some of those regulations and give us more flexibility in using the funding, for instance, around behavioral health or mental health services. That's a lot of some of the barriers that we're facing. The same challenges in the rural counties are not the same challenges that are happening in Los Angeles or in the Bay Area.
Exactly. And I noticed that the question is very broad. I know it's vastly different throughout Northern Region California. Even though it's all grouped within the Northern Region, different zip codes, obviously, we know that determines your life expectancy and different health outcomes. And I agree that we do need to address ACEs because we need to break that cycle. And if not, you were talking about multi-generational trauma. And if that keeps going, then we're not going to get down to the bottom of the actual problem.
Absolutely. And I think that those are some of the things that we're addressing with our Thrive program, is looking at some of those key areas that around ACEs, and around mental health. So some of the areas that we're looking at is, for instance, youth mental health and suicide prevention, as I mentioned before. Another area that we're looking at is essentially domestic violence, violence in the home, whether that be child abuse or intimate partner violence. That actually is a key indicator. It's a canary in the cave, if you will, of the problems to come. And so some of those root areas that we need to address around education, around prevention, around rehabilitation, about those types of things. If we don't address those now, we're going to see those effects continue over the course of the next decades. And that could be everything from incarceration rates. It could be like, it will have impacts on public safety. It will have impacts on a lot of different areas in our county that are important for a quality of life for many people, but we can't ignore those indicators before it gets to those problems.
Exactly. A key thing with public health is that prevention is the key before we get, even worse health outcomes. And also,
absolutely,
you already basically discussed some of the ways in we're eliminating barriers and disparities that not only just Northern Region California, but also internationally about mental health and prevention. But do you think there's other ways in how we eliminate these challenges? And there's also program implementation as well. But I know that's kind of like a broad question to ask.
It is a broad question, but it's a good question. And one of the other projects that we'll be launching here soon in partnership with the Feather River Health Foundation is what's called the Blue Zones Project. And I think that you obviously, we need to address some of the social disparities, but there's also just how do we plan and build for our future regarding health? And there is a lot of prevention in there, but it's everything from access to food. Our county, there's a lot of food insecurity, and just hearing stories, even with our elder population, that are not eating the types of food that they should because of access to that. We need to make sure that we have better nutrition and food hubs that are and access to that in all around our county, not just in certain pockets. And right now they're just ice. We have food deserts in some of those areas. So nutrition is a big piece of it. But then also there are areas, for instance, obviously physical activity. These are things that are happening with youth and families where we need a more robust and incentives for having families go out and exercise more and be more active and walk more, and the importance benefits of those things. And so, yes, there's access to programs and resources and services, but there's also things that we need to really put into place that will help our community think in a more health conscious way. So those are some of the areas that I think that we could.
Great, thank you so much. It sounds like we really just need to get down to addressing different social determinants of health that are specific in different communities to really improve health outcomes in the future and really break the different barriers we have in health.
Absolutely, yeah.
All right, thank you, Jovanni. That should conclude our health equity campaign interview today. Thank you again so much for participating in our interview.
Thank you so much, Lisa, and thank you so much for the work that you all do.
Thank you, as well as you too as well. North Valley Community Foundation has been partnered with Healthy Rural California too, and we are very grateful with y'all's support.
Thank you.